All right, well, good afternoon, everyone. Let me just thank you all for being with us today here at the Georgia World Congress Center. We just did a little walkthrough of the temporary facility that we've stood back up that will allow us to have 60 additional beds, including staffing to help our hospitals all over the state that may run into any patient overflow here in the next week or throughout the next month. So I want to certainly thank the Georgia World Congress Center for their cooperation as they have done prior to this. Also, the folks at Grady that will be staffing this, they've been a tremendous asset to all of our hospitals in the state, especially helping with this temporary facility in the past. They're going to do that again, so they're ready to roll. Also, their coordinating center, the state has invested a good bit of money in during the pandemic to help us coordinate bed space throughout the state, so we haven't seen issues like we've had in other states where we couldn't find a bed, a hospital. There's one place that they can go, and they will help them find a bed if that ends up being the case in our state. So we really appreciate the investment that Grady has made there, but really the state as well, and I want to thank the General Assembly for their support of those efforts through our CARES Act funding. As you can see behind me, we now have an 80-day supply of critical PPE that our hospitals, long-term care facilities, and other folks may need, health departments and others across the state. The availability of PPE is still very good right now. I haven't heard of too many issues that are out there, but several weeks ago, even before we saw our cases climb and we saw that happening around the rest of the country, I've asked Director Chris Stallings from the Georgia Emergency Management Agency, who joins me today, to really look at seeing at getting us additional supplies of PPE should we have a case for the need more so than we had. I mean, one of the things we learned early on was these supplies can get very tight when you think about ventilators, PPE supplies. We did not want to run into that issue again. Certainly appreciate the CARES Act funding that's given us the ability to, have about an additional 20-day supply of PPE over our normal stockpiles, and that is why we're housing that here at the World Congress Center. Our other warehouses are full, so the good news is we are ready for anything that comes our way in regards to PPE, and I think that gives a lot of folks in our medical facilities and hospitals a good peace of mind in regards to the PPE supplies. So I'll just ask Director Stallings to brief you real quick on our PPE supplies and what they've been working on really even before we got into this case increase and hospitalization increase we're seeing. Chris.
Thank you, Governor. As what we saw around the country was that PPE was being very difficult to get our hands on, so we took a proactive step through the leadership of the Governor and his office, and we made what you've seen behind us here a $16 million purchase for additional PPE. So this is a little more than $16 million. We've got a couple other trucks that'll be coming in tomorrow, but that will finalize everything that we have. That will put our state's stockpile at levels we've never been before. We'll be able to handle anything that we see coming in the near future. The minimum will be 80 days supply on all our critical points, including face shields, N95 masks, surgical masks, coveralls, gowns, and gloves. So we're there. Some we even stockpiled as high as 195 days in masks. So we're at a place that our state hasn't been, and so we're very proud of the leadership of the Governor and as he said through the CARES Act, having the ability to put our state in a place that's keeping us ready to move forward.
Yeah, the last thing I'd mention just before we open it up for any questions you guys may have, we do believe we'll be able to start taking patients in the next 24 to 48 hours, hopefully in this facility. I think the hard asset part of it, bathroom facilities, the beds, the nuts and bolts, the cafeteria, the monitoring station. We have a little bit of work left to do on the IT side of things, but that's just a couple of hours when the staff gets here. We're just trying to get the staffing in place. We have that contract approved and they're ready to go, but just trying to get all the boots on the ground is really the only thing we're waiting on. We're hoping, hopefully midday on Thursday we can start accepting patients and give a little bit of relief to our area hospitals. I would note that still Bill, even with the increases we're seeing in our hospitals, we're still around 25 to 27% on average statewide of COVID patients in our hospitals. So there's a lot of an additional care that's being done in our medical facilities around the state. I think that's very important for people to know. We want to be able to help provide support so that they, if at all possible, can continue doing these type treatments to get all Georgians care, whether they have COVID or not. And that is our goal in this. But we also need our citizens to help be a part of that solution and not part of that problem as we go into New Year's. We're seeing predominantly the number of cases coming from 18 to 29-year-olds. So if those individuals decide to go out and partake in gatherings during the New Year's holiday, I would urge them to limit those, to wear your mask, social distance, follow the guidelines. I'd ask that our, other establishment and businesses around the state do that as well. But if you have any doubt about that, get tested. Post-holiday, don't go home and spread this virus to your parents or grandparents or a medically fragile person, and let's help flatten the curve, stop the spread, and get these numbers going in the opposite direction on our COVID patients in hospitals. And with that, we'll take some questions.
Do you have the staffing in place to handle 60 beds?
We do have the staffing in place to handle 60 beds. We're continuing, I'd let people know that we're continuing to follow up on other avenues that we have for hospital bed space, not only in the metro area but in other parts of the state. So we're going to continue to do that as long as we need. We will unturn every stone that we have out there. We've been in constant communication with our hospital CEOs around the state. I talked to 11 of them a couple of days before Christmas. I know our team has been on, I can't remember if the call was today or we're doing that tomorrow with the rest of the hospitals around the state. So I feel really good about the level of communication and where we are, and they know to call us if they need something. And lastly, I will say, despite the hard time our hospitals are having, I know their staff is working extremely hard. I'm very grateful. I hope all Georgians will keep those patients and caregivers in your thoughts and prayers. There's also a lot of excitement in our hospitals because they are administering the vaccine. That is a great testament to Operation Warp Speed, to the Trump administration, and this medical miracle that we are literally seeing play out every day. I had a nursing home owner today text me about, he's been in this business 40 years. This is probably the single greatest day he's ever experienced because they're distributing and giving the vaccine in their facility. So they see light at the end of the tunnel. But that being said, it's going to take us a while to get it out to the general public. So we got to be vigilant, mask, social distance, and follow the guidelines.
Are you planning on opening any facilities like this in other parts of the state, utilizing other state resources?
Well, we're certainly, with the extension of the CARES Act funding, I certainly appreciate everything the Congress and the President has done to give us flexibility going into the new year. We are turning those stones right now. As you know, we have the temporary facilities that we've shown off before that are being used right now. So that has been a great investment for our state that we saw early on we needed to do, and they're paying great dividends. But we're looking at other potential facilities, other hospitals that maybe could ramp up with additional bed space. The real issue there is the staffing. Because of what we're seeing going on in the rest of the country, the staffing issue has been the hardest for any governor, any hospital CEO, and it doesn't matter what state you're in. So thankfully we're seeing the Midwest start to decrease, so hopefully that'll free up resources that can start going to the coast that now are experiencing this bump. But we're going to continue to run the due diligence on that and do what we need to do to be supportive.
Have a preliminary idea of how many check-ins you could have if you open up on Thursday, who would be waiting to come in?
Well, it's really hard to tell, but from what my team's telling me, I think we'll start seeing the patients immediately. I mean, there's definitely hospitals that need the relief. Some are in better shape than others, but I think having a COVID-type facility helps free up other beds in their hospitals, which they desperately need, and it also helps keep separation with those patients to keep everybody safe in those facilities. But I think we'll see that usage immediately, unlike last time when we opened up and we just had a few patients trickle in and then a few more after that. I think this will be a time when everybody is ready for the relief.
What is the cost associated with opening? I think over the summer when we had that period, it was somewhere in the 20 million. Is there an estimate on cost?
Yeah, I think we're looking at the $16 to $18 million range right now for the 60 beds that we have. I know the PPE, we spent about $16 million on the additional supplies, which I think is a really good investment. Director Stallings and his team was just briefing me on the walkthrough that they're also planning, because I asked them a question. I said, well, what if we don't use all this? I mean, we need to keep a stable stockpile for any events, whether it's a hurricane, tornadoes, other things, hospital. You have a water main break, a fire damages a lot of PPE. We need to have those things on hand. But they're talking, and you may speak to rotating the supply out, working with the hospitals, and how we keep the supply chain fresh. I don't think we have all the details, but I think you can speak generally to that if you'd like.
Something that we're looking into and trying to work a process out is that we become essentially an immediate response for hospitals and things, and as they need those, they can immediately come to us in the state of Georgia to fill those needs immediately, and then as they get supplies in, we can backfill our supply so that we maintain a fresh stock of the equipment. We don't lose anything to expiration dates.
How is it transported out? You make the request and then how does
Yes,
it get?
ma'am. It would come through, so we have a system through our web EOC where they would go through their emergency management, make a request into the agency. Once the agency recognized the request, we would distribute that request out. Once it was filled, they would make a purchase, and then it would meet certain specifications and come back into the warehouse.
I think one of the good things about the state response and just the experienced professionals that we have at the Georgia Emergency Management Agency, unfortunately, because of past storms, whether it be Hurricane Michael, tornado events, other storm events that we've seen, we have a lot of experience working through those local emergency management agencies. Director Stallings, Director Bryson before him has a great relationship with those folks on the ground, so that system has been battle tested many times, and it's worked great during the pandemic, and it's kind of a one-stop shop for a county or a hospital in a county to go locally, then they feed it up into the state system.
Sir, I hear the optimism in your voice. Can you speak to Georgians who may not be as optimistic because you see the total utilization of resources? Can you just speak to those Georgians who may not be as optimistic as you?
Well, I think, one of the things that's been concerning to me is about the reluctance of some to take the vaccine just for whatever reason, because of historical events, also of how fast it's come to the marketplace, making sure that it's effective and safe. I'm 100% confident that's the case. We've been given a lot of vaccines over the last 2 or 3 weeks. You saw the excitement in Dr. Toomey's eyes when she got the vaccine. Literally the optimism of these hospital CEOs, they were just overjoyed to be vaccinating their people and help protect those that are on the front lines of the COVID fight. Unfortunately, there's some, even in the healthcare space, that don't want to get the vaccine. I would urge them to do that, and we're trying to get them to do that, but if they're reluctant to do that, we have a lot of people right now, our first responders, teachers, other medical professions, veterinarians and others, and the general public that want to get the vaccine. So we're going to keep rolling that out, but I want to encourage to everybody to take the vaccine. I'll be doing that as soon as I become eligible to help continue to build the public confidence.
Thank you, sir.
Governor, is it with adding several thousand cases per day, as we seem to be doing in recent days, is it time yet to look at either targeted new business and gathering restrictions or more of a statewide effort? Like your thoughts on that?
Well, I've certainly been watching the numbers. I think, it's been fairly stable over the last few days. I think we got to let that play out with, testing decreased, obviously, Christmas Eve, Christmas Day. We feel like that'll be the same on New Year's. But, we had one day where they reported, and it probably wasn't all tested on the same day, but almost 50,000 tests, which, caught my eye when I was looking at the numbers. The thing that I'm watching, and I've said this many times, is I'm watching the hospitalizations. We've got to continue to work through this. You're looking at other states that have had lockdowns like California. They have a much worse hospitalization situation than we do. People know how to deal with the pandemic. We have learned from the past of how we fight through that, and it is for our citizens to be part of the solution, not part of the problem. Mask up, limit your gatherings, you know, just take this New Year's Eve celebration, you know, do it at home with a small gathering of people, do it virtually, but let's just try to help those that are on the front lines working so hard to keep people safe and healthy, and get them recovered from COVID in our hospitals and help them flatten the curve and get these numbers going the right direction. I believe we can do that.